My name is Richard D'Amico. I practice in the New York metropolitan area. I've been a board-certified plastic surgeon for 27 years and in practice for 29 years. My practice is both clinical and academic, but primarily clinical. I hold a faculty appointment at the Mount Sinai School of Medicine in New York, and I have offices and operating facilities across the river in northern New Jersey. In terms of my professional life, I've enjoyed the opportunity to serve the Plastic Surgery Society. I've served the American Society of Plastic Surgeons for 25 years, culminating in 2008 with my presidency of the American Society of Plastic Surgeons. Since that time, I have been elected to the Board of Trustees, which is the elder statesman of the Society, or so they say. And I've served on many committees of the Society. Well, it's critical. Surgical training is what distinguishes us, and it's absolutely critical. It's what makes a young doctor who's learned a lot of science into somebody that you want to trust yourself to in the operating room under the knife, and it's the whole difference. Suffice it to say that basically one's about 36 years old and has probably put in 15 years of one's life to acquire the skills to take a patient to the operating room and do the surgeries that we do. Right? The point of training and credentialing is to be able to deliver good outcomes, good results to patients with a maximum of safety. And unless one has gone through that process, it's more difficult to be confident in the person's ability, that doctor's ability, to deliver those good outcomes with good safety. Of course, one of the tenets of training and credentialing is the quality of care. And it begins with the preoperative care, selecting the right patient, making sure you don't operate on folks whose risk is very high. A lot of the outcomes are decided before the surgery is ever performed by the selectivity of the surgeon, choosing the right patient, understanding their entire health history, and understanding the significance of that for the operation. And someone without this rigorous training may not be able to spot some of those pitfalls. And so the patient is already a bit behind it before you've even gone in the operating room. Then you go in the operating room, and these surgeons often lack the duration and depth of training, otherwise they would have gone through it. So they have less resources to call upon while they're doing the operation, and most especially, things do happen and things can go wrong. And the ultimate measure of a highly trained surgeon is how they handle difficult moments in the operating room, very similar to how pilots are measured by how they handle difficult moments during flight. And that's what we thank them for. So a lot of these resources aren't there in the surgeon who doesn't have the training. Afterwards, of course, the dedication to follow-up, following the patient, not just to make sure they do well, but to document outcomes so we can tell people how successful our procedures are. If one has a trusted physician, you may get referred directly. You may have experience with a trusted friend who went to a plastic surgeon. But by and large, that isn't the case for most consumers. And the problem that we have now is that there's a tremendous amount of information out there on the web. And at least in the States, most folks are thinking about these things at 10 o'clock in the evening. And they go on the web. And there are just a plethora of sites and no real filtration of those sites by and large. So it's sort of a consumer beware, buyer beware type situation. So it can be problematic, and some of these websites make claims that are quite dramatic and not substantiated. And we see some disastrous complications, and the complication often doesn't set in till the patient's back home. And then they show up on the doorstep of an emergency room or start calling around desperately trying to find someone to care for them. The most interesting thing I'm doing right now for the Society is chairing a task force on regenerative medicine in plastic surgery. And this is an exciting area that has to do with stem cell therapies, fat transfers, tissue grafting, tissue engineering. And I'm chairing that task force for the ASPS, but it's an international task force with colleagues from around the world. And well, I'm quite familiar from my international activities through ASPS in America with a lot of the standards of international training. And the Australian standards and trainings are absolutely first rate and up to snuff with anything that we do. So I think it's a terrific service to be able to know that you're dealing within a pool of people whose credentials have been verified, so that you know that if there's someone there that you're a good fit with, that chances are they're going to be able to provide you with a good result. Because a pretty office and a charming personality and a good wardrobe doesn't make good results necessarily in the operating room. Training and credentials do.